In late February of this year, a call was made to public health officials from a staff member of a nursing home in Kirkland, Washington, expressing concern for residents and staff who were showing flu-like symptoms but did not test positive for the flu. Soon after, the entire country was shaken by the news that COVID-19 was now at our doorstep and posed a threat to all of us, in particular those 60 years old or older. While we all waited for guidance from public health and government officials, fear and uncertainty was at the forefront of our minds. Now imagine being told that you have COVID-19 and you are one of the first people in the region to have it, plus you are over 60 years old. Thank you for joining us today. My name is Joan Rettman. I am the Area Community Relations Director for Era Living, which is the parent company of the Gardens at Town Square and home to Van Anderson, who was one of the first to be diagnosed with COVID-19 earlier this year. Thankfully, she has since recovered and she's graciously offered to share her story with us today. Now, you will notice that Van and I are not wearing masks today, and that is because we are in two different rooms within the Gardens at Town Square. We follow COVID protocol very closely here and advocate for everyone to wear the appropriate protective gear and follow social distancing as directed. We believe it's one of the reasons that our company and our community is currently COVID-free, and that our company, Era Living, has an infection rate of only 0.06% compared to an infection rate of 6% of all those tested within King County. One quick side note, if this number surprises you at how low our infection rate is, it might have a little bit to do with some of the reports on the news, which have actually blended the cases of retirement communities like ours with nursing homes, like where the spread of COVID-19 began in this area, which unfortunately resulted in a misperception of how COVID has impacted communities like ours, compared to nursing homes, which is a very different model than what we are. Now, allow me to tell you a little bit about Van. Van has been a resident here at the Gardens for about 6.5 years. And if you've ever visited the Gardens in the past, there's a very good chance that you might have seen Van out and about, as she has been very actively involved in our community as president of the Resident Council for the past 3 years, a Thrive Steering Committee member, a member of the Gazette, our community newsletter, and many other things. Before moving to the Gardens, Van lived in the Bellevue area for 65 years, 55 of those spent as a real estate broker. Van has also been very active in the political community, focusing on affordable housing and housing for children. Van, thank you so much for being here today to share your story with us. I know it means a lot to everyone on this call today.
Oh, you're welcome. I'm glad to do it.
Great to have you. And many of the questions that we're going to go through have been shared in advance by a lot of the people who are on the call today. And so we're going to get started with the first question, which is one of the most popular ones, which is, let's begin with you sharing what it was like to have COVID-19.
Well, the first thing was the shock of having it, because the doctors at Kaiser were floating then, and I didn't have my own personal doctor, so the doctor that reported to me said, you're positive. And I blurted back, am I going to die? Because there was no handbook that came with the virus, and we didn't know much about it. So having it was, the greatest thing was the unbelievable fatigue that went with it. I just could hardly raise a cup of water to drink. So that was the biggie.
Mm-hmm. Thinking back, is there anything that stands out to you that was the hardest part about having COVID-19?
Well, it'd probably be a toss-up between that fatigue and the isolation. Totally isolated, and we didn't know much about it then. And also another thing that came to mind was didn't know whether or not having it was giving you any long-range immunity. Mm-hmm. So have it once and survive, have it twice and die was kind of the thought that went through your brain.
Yeah. I can only imagine how it would have been very, very scary to have had it, especially early on. It's hard for anyone to get the word now, but even especially early on, like you mentioned, when we didn't really know much about it at all.
Right.
Yeah. Okay.
The family was concerned, but I'm a survivor. I've survived cancer twice and now the virus, and so hang in there.
Yeah. How long was your total recovery time?
It was 2 or 3 weeks before I really got my full strength back. Where I could get up and do my own work and one thing another. It was very slow in coming.
Yeah. And did you, over that time and while you were regaining strength and feeling better, were you still testing positive for the virus for a little while?
Well, they kept testing me here in the facility, in the garden, but my own doctors preferred not to test me again. They apparently felt the initial test was sufficient. And so they didn't retest me. So I don't know whether I ever tested positive again or not. I guess I must have gone negative because our own facility quit testing me. Had me take my blood pressure and my temperature every day for 2 weeks in my own apartment.
The team here was really keeping a close eye on you, I think, after you tested positive. And yes, I think that you're right. When somebody does test positive, there's a close watch and repeated tests until we learn that somebody is negative. I just imagine that probably felt like it was forever after having those symptoms before getting that news.
I've said it before that I think Nissan deserves a medal for containing it so quickly, because the rule that we had about not going to dinner if we had a fever undoubtedly saved my dinner table from catching it, because I had the fever thinking I had an upper respiratory infection, and I communicated with my own doctor for an antibiotic, and that immediately had him get me tested. So that's how I happened to be tested, and nobody that were my dinner partners got it, thank God.
Yeah. How quickly was that, Van, when you first started having those symptoms when you were tested? How long did that take?
Well, immediately the next day, when my doctor found out that I had the symptoms that I thought was upper respiratory infection, then they had me come right out, and they had a facility set up in one of the drive-ins in Eastgate. And a surrogate grandson of mine took me down there, and I got the test, and that's where it came back positive.
Yeah. I'll just add one other little note for our listeners here. When Van was speaking about having symptoms or the fever and going to the dining room, remember this was way back at the very beginning,
March 12th.
March 12th.
Yeah.
Okay. You remember the exact day.
Yeah.
And that was before Governor Inslee had shared with everyone what restrictions should be in place to try to manage it at that time. Yeah.
It was just a blanket rule for any kind of a fever that might have communicated the flu or a cold or whatever. It was a very good rule, and I compliment them for having had it.
Yeah, it's kept a lot of people safe. Yeah. How about the next question, which is, after you were diagnosed, did you have a choice to remain here at the gardens or to move in with family to take care of you while you were sick?
I had the choice, and I chose to stay here because I didn't want to, do anything that could possibly infect any of my family. And we knew so little about it, what treatment was available, etc.
And looking back now, do you feel that you made the right decision to stay within the gardens?
Oh, yes, because I got excellent care. I'm sitting here live and smart alecky, and shooting my mouth off. So yeah, I think it was the right choice.
And we're all very happy about you being here with all of your spunkiness, Van. It's great. Along the lines of the restrictions, so we were just talking a little bit about shortly after your diagnosis, Governor Inslee had shared restrictions in terms of what happens inside retirement communities, such as the dining room closing and public areas closing. And there was the stay home, stay safe, stay at home order that went into effect all around as well, but pretty heavily restricted inside the communities. What has it been like living with those restrictions since that began in March?
Well, I miss vanity about getting my hair done, and the restriction that's blown me away is not being able to go and get my hair done. So I crab about that all the time, but I'll live through it.
Yeah. And while the restrictions have been in place, of course, that's been limiting the type of interactions that residents have had here with each other compared to normal in different ways. So how have you been staying engaged personally and staying active while under those restrictions?
Telephone, cell calls and note writing and, just trying to keep as communicated as possible.
Mm-hmm. Do you ever have anyone speak with you outside the communities?
Oh, yes. I have lots of phone calls from I'm real active in politics, so I get a lot of phone calls, a lot of cell calls.
Yeah. It's a good way to stay connected through Zoom and phone calls for a lot of people.
Exactly.
It sounds okay. At this time, would you say, do you feel safe here at the Gardens overall?
Oh yes. I think that all of you have bent over backwards to ensure our safety. The kitchen and all the servers have been so good about our meals being served, and it's in a plastic bag on the door handle of our room. But it's a lot better than having a reoccurrence of the virus, I'll tell you.
Yeah.
Very accommodating about fulfilling our needs for extra beverages and taking care of us. Some of us, you might not know, we have a shelf outside of our doors, and we get excellent communications through our administrator here, and we're totally up to date on where we're standing, and that's been encouraging also.
Along the lines of safety and what types of measures were put in place here, is there anything that you can speak of that really stood out to you that happened to make sure that the residents living here were staying safe?
Well, I think the initial one about the fever is the greatest thing that could have happened to us, and then making sure that it was kept in place, and that we weren't, the placing of the plastic by the front desk and eliminate stopping extra visitation. And I just think it's been managed here outstandingly well. I think ERA should have a big feather in its cap.
Mm. Some of the things that that Van's referring to, the glass at the front desk, is it's like a shield of plexiglass that is in front, creating a barrier, but provides ease of communication for anyone coming through the front door. That has been a nice addition, I think, for a lot of people. Other things that a lot of people don't know that happen behind the scenes would be the extra touches, the amazing amount of cleaning and disinfecting that happens in communities like ours.
And the taking of our temperatures as we come in.
Yes, yeah. That's been a really big deal for that. And what a lot of people aren't aware too, just to share on a quick side note from from the perspective of a staff member working in a community like ours is there's been an interesting shift in roles too. So we all chip in to do what we need to do to help make sure everyone's safe. So you can imagine what we've been doing with cleaning the community and the requirements that takes. And so we've all worn different hats to make sure that those types of measures have been in place to have all of the cleaning in the high touch areas, several times a day initially until we were feeling very comfortable in seeing any cases in the community subside, which now we are at 0. So it feels very good and reassuring to also work in an environment like this, to know that those measures have been incredibly effective, and we feel good about that too.
Another compliment I'd like to give the staff is that the rule about one person at a time in the elevator. Anytime I've had occasion to have the elevator come up and a staff person be in the elevator so that I would be precluded from going in, they've been thoughtful enough to step out and say, you go ahead, I'll get the next one. So it's another thank you to them.
Yeah, that's great. How about, how would you describe the communication from the staff to you as residents or to family members during the first several months?
Oh, I think it's been unique and outstanding. I think April's done a yeoman's job of not only communicating to our relatives, she's allayed all my daughter's concerns about me being here, and then the communication to us ourselves about how to maintain ourselves and the restrictions that we should impose, and has been very, very helpful, very supportive.
And April Huban is referring to April Tolstoy, is the executive director here at the
Right, April Tolstoy, that
yes
gives us communication several times a week and to the status and the governor's position and what's being done and how many people are being tested and how many people are positive and how many people are negative. And the controls that have been imposed have obviously restrained that expansion.
Mm-hmm. I know that with my role and working with a lot of families before moving into the community, they would ask a lot of questions related to this one very common question: what is communication like? And that's got to be so hard for families to not be there and know what's going on. So that communication really was key. Memos printed and delivered to the doors of each of our residents every single night for a while, as you mentioned, and to family members too, who would worry so much, especially early on, would consistently praise the communication and be so grateful to hear those updates.
And then setting up the program of the visits in the garden, where we could be separated sufficiently and still see people.
Yes, it's nice to be to that point now, and especially with nicer weather, to be able to have family members visit now according to a schedule, and that allows us to clean appropriately those spaces in between each visit.
Right.
But to have that FaceTime again, even though it's 6 feet away and with masks on, is really special, isn't it?
Yeah, because that human dialogue between us is very salient to our mental health well-being.
Mm-hmm. Very much so, yes. How about for you, Van? So as I mentioned in the introduction about you, that you're part of the Gazette, which is our community newsletter here. How did you use that opportunity to be connected with the Gazette to communicate about your experience to other residents who live here at the Gardens?
Well, I wrote an article about what it was like to be first one in your family to go to college, the first one in line, but not the first one to have the virus. And it got a few chuckles, and so that communicated too. everybody that I had experienced it, and thank them for their prayers and their care.
You've never lost your sense of humor throughout this whole experience, have you, Ben?
Well, your sense of humor, I think, is the best salve you have for any wound. And if you can keep smiling, it certainly precludes pain in the heart.
Yeah. With communicating directly with your family and loved ones, what would you say was the main means of communication, maybe other than phone calls during this time and now?
Well, they came and stood down in the street and talked to me through the open window. I'm on the 3rd floor, and so they could stand across the street in front of the elements, and we could talk via cell phone. So that was stimulating and encouraging that they cared enough about me to do that. Actually, a lot of my friends did it as well. The CEO of our board of realtors came down twice, make sure I was alive, which I told him I intended to keep being. So it's been an experience.
And I would say for anyone who wasn't familiar with Zoom before, most people are pretty familiar with Zoom now. It's really gotten a lot of use
Right.
over the last few months too. Yeah. One of my last questions, and then we'll go ahead and check chat and see what other questions have popped up. What would you say to those who are feeling very fearful to move into a retirement community because of COVID?
I think being in a retirement community where you're constantly monitored, where the extra cleaning of surfaces and the prohibition of numbers of people in the elevator together, all the imposed safety rules, I think, make this the safest place for us to be. I'm very glad that I'm here.
Do you feel that it's safer or safer here than other places?
Oh yes, safer, because they're not about to let anybody near me that might conceivably infect me, and that would not, there wouldn't be any guard at my door if I was still in my own home. You know, anybody could come to the door and not be masked. And a lot of people are mixing science and politics now, and they think if they put a mask on, they're violating their political ideals, and which is pure stupidity. So no, I feel like I'm extremely safe here. I wouldn't be anyplace else.
Okay, great. Van, is there any other advice that you would like to offer in general about this situation?
Well, I'll say what the governor says every night: wash your hands, wear your mask, and don't, if you see somebody, you know, I've got a breast pocket here and I keep a mask in it and change it periodically is described for safety. And that's what everybody should do. And that's what all the scientists are saying. If we all mask up, we can stamp it out. If we don't mask up, it's going to continue to be a worldwide pandemic.
So one of your messages is follow the guidance that's out there. That is
exactly. Dr. Fossey, he knows what he's talking about, obviously.
Okay. I'm checking our chat really quickly to see other questions that might have popped up, and looks like there is a question. We'll repeat the answer to this one. The question is, did Van recover at the Gardens, and how long did it take to get back to your health? And
I did recover at the Gardens. By the grace of God, I did not have to be hospitalized. And it took me about 3 weeks to totally get my energy back. Mm-hmm. There was a while when I was eating chicken broth and lemonade, and I didn't even care if I had that. So it took me a while to get my energy back, but that was the biggest symptom that I experienced.
Mhm. Did you, from having experience, having had the flu or other illnesses in the past, how did you think this compared to other illnesses that you've experienced?
Worst fatigue I've ever had in my life.
Okay.
Yeah. Worse than the flu. You know how you get achy with the flu? This was just utter total fatigue.
Mm-hmm.
Just, I don't care if I get up and move because I can't get up and move.
Yeah. Okay, this is an opportunity for anyone else who would like to ask a question through chat to go ahead and submit those questions. So I'm going to check that again in a minute. What I will say in the meantime is, you know, Van, we're so grateful that you were able to share your story today. I know that it's if someone hasn't had COVID, they worry about getting it, not knowing what it's like. And there are so many people that ask questions about moving into a retirement community, but are so worried about the timing of it, worried about what the restrictions are like, and if they're going to catch COVID by moving into a community. So having you here to speak to all of those things in person, I know is immensely helpful. That's what's on everyone's minds these days.
Yeah, no, I am completely convinced that my being here has been my greatest safeguard. And because they're stimulated by obvious their desire to keep us all well, so they bend over backwards in keeping the restrictions imposed, and I just don't feel I could be in a safer place. I sure don't want to be in the hospital with a breathing tube stuck in me.
Yeah. Yes, thankfully that was not part of your experience. A couple other questions have come in, and one of the questions is related to meals, if residents can get meals now. Van, would you like to talk about that, or would you like me to talk about that one?
Well, I'll talk a little bit about it as a participant. I happen to be allergic to garlic, and so the kitchen bends over backwards to call me every day and make sure that I'm not getting anything with garlic in it, and to choose a meal, and then it's served in a plastic sack hung on my door handle. And so I think all the safety precautions are in place, and I'm very grateful for that.
Other questions are rolling in here, which is great, really good questions. One of them is, did any staff members test positive? Which I could probably speak to that one a little bit.
Right.
There have been other cases since Van, both residents and staff, that have happened, especially during the first month. And so if there has been a positive case for a team member, of course, they would not continue to work into the community until a negative test was in hand, and then would return. To speak to other residents that have had it, like Van, most people remained, of course, in their apartment with extra precautions that are put in place. You had heard Van mention that team members were coming in and checking on her on a regular basis. Van, do you remember all of the gear that they were wearing when they would come in to see you, what they were dressed like?
When they finally got their handbook in place, because, you know, this was a ball hit way off side field and nobody was there to pick it up and pitch it back. And so I look back now and see the look on Cindy's face when she came to my door, and the first initial thing, well, after that, then they came in with hazmat uniforms that made them look like walking blue shadows.
Yeah.
And of course, they've done all of our testing, but I was given outstanding care, outstanding. I couldn't ask for better.
There's kind of a series of questions here, kind of lumped together with the same question. So I'll kind of phrase this in a way that summarizes it. There, in terms of the frequency of you having checks when you weren't feeling good, when you were feeling really tired, having that fatigue, did you feel like you were being checked on enough to make sure you were getting enough liquids, that you were having all of your needs met while you were feeling your worst?
No, I thought they were doing what they needed to do when I might not have been careful enough or cognizant enough, because ordinarily when you get something, you build up this degree of immunity, and now they tell me that there's only a couple of weeks. So the fear then, once you know that, is that you're going to contract it again. So being careful is very important. And
yeah, I will add too, this will kind of answer the question too about what it's like living in a retirement community at this time, is that you can imagine the amount of extra supervision we're providing for residents who might have COVID, by the frequent checks to that person individually. But there is also a protocol in place to check on all of our residents every day because of the COVID situation, to ask about symptoms. Yes, right. So it has been something that Era Living has implemented to make sure that we're getting ahead of any other potential problems, to then have testing done very quickly. One of the questions here is testing available at the gardens now? Because back at the beginning, Van, as you had mentioned, you went to Eastgate to get tested, and the answer is yes. So some things that have changed over time is that you probably heard a lot about this on the news, that the access to testing, medical equipment, all of it was a bit of a challenge. And so one of the things that Era Living had done so well, which is very unique, is due to the longstanding relationship that we've had with the University of Washington and the medical department there, the School of Nursing, yes, in particular, we were able to do broad testing in our community. And by that, I mean test all of the residents and staff, whether showing symptoms or not, to try to get an accurate measurement of the virus, since there was a lot of discussion about possibly being asymptomatic but still being positive. And in order to wrap our minds around that and get accurate information, we pushed very hard to be able to have that broad testing completed to know. Since then, you've probably heard on the news that Governor Inslee had made that a requirement sometime later for certain types of communities that provide care to be able to do that. It remained an elective for our company to do that because of the model type that we have to a certain degree, but we did it again anyway. So we've done broad testing at least a couple of times, well before other communities had been able to have access to that. We're so proud of that. That relationship has been beneficial in so many ways. And now I see the value even more. I know a lot of the residents do too, to be able to have that access to that information. But since the testing kits have been able to catch up a little bit with the situation, we do now have test kits on hand here at the garden. So we do have the ability to test residents directly now, and we send that information to the lab, but we can do that now for residents and staff also. I have a note here for you, Van, from someone who wants me to read a message to you, Laura Gordon and Phil Klum.
Who?
Laura Gordon and Phil Klum.
Oh, yes.
And the note reads that we miss our dinners at the gardens with you, Barbara and the gang. We always look forward to your sense of humor and political insights. Looking forward to seeing you again.
Oh, thank you so much. That's Barbara Jacobson's daughter. And we have lively conversations. And that's one thing I miss. I miss so much the dining room. I can't wait until we can get that back.
We all look forward to that too. So, okay. Well, I think that has concluded our questions. So, so I think in conclusion, I'll say again, thank you, Van, so much for sharing your story again with us. And if you who are listening have other questions about COVID-19, including what that might mean for you personally, if you are considering a move to a community like the Gardens at Town Square at this time while we have restrictions in place, you can feel free to reach out to any of us that are in the community relations department here at the Gardens at Town Square, and we'll be happy to help. The number here is 425-688-1900. And please also remember to reply with your feedback for us. We'll be sending that email out to all of you very shortly to ask for feedback about your experience that you've had on this call today. So thank you again for everyone who attended. Thank you so much, Van.
You're welcome. Thank you for putting this together.
You're welcome.
I want to show you something. Look at the beautiful dahlias that I got from one of our staff that I interviewed for the Gazette.
Those are very beautiful.
Yeah.
Our dining services director, Craig, has the most beautiful garden, and he brings those fresh flowers in every day. And those are our special ones just for Van.
Yeah, thank you so much.
All right. Thank you, everyone. Thank you so much for attending, and we look forward to hearing your feedback very soon. Have a wonderful day.
The same to you, all of you.
Thank you, Van.